Bridging Health Care. And I am your host, Bridget. Thank you for joining me on this channel. The main focus is helping us to become highly effective healthcare worker, bringing informative, educative solutions to our world. I am so happy you're here. Sit down, relax, like, share, subscribe. Thank you. Hello, guys. Good morning, good afternoon, good evening, wherever you are. My name is Bridget, and this is Bridging Healthcare. It's so good to come back to you again to talk to you. How have you been? This channel is poised to support healthcare professional or would-be healthcare professional on how you can be effective and efficient at your job. I come up with ideas that are educative, that are informative, that are up to date, that are important, that makes you exceptional. I myself, Bridget Ezobiako, I am a healthcare professional, and it's an honor, a big honor to be talking to you today. I love what I do. A lot of healthcare professionals are in the field either for the money or because of the situation they're in now. Maybe they are nurses, they've not been able to get a job, or they are doctors, they've not been able to get the qualification they need. You know, many of us come into this line of work for many things, but I came in because it's a calling. I am satisfied. I strive to be exceptional at what I do because it gives me personal fulfillment and satisfaction. And that's how I think you should approach your job. So today I just want to play around general things around how to live your life as a healthcare professional, the posture to take. And if you've checked my other videos, being a healthcare professional does not just mean one thing. It means many things. You can be a social care worker. You can be a mental health care assistant or a mental health care worker. You can be a nurse. You can be a doctor. You can be a physiotherapist. You can be an occupational therapist. You know, it's a wide range of activities that can be done by healthcare professions, and healthcare professionals do different things, and they are found in different spheres of, you can find them in the hospitals, you can find them at the home, you can be a carer, you can be a support worker, so it's vast, it's wide, and it's beautiful. So, but today I want to talk about how you approach your job as a healthcare professional, and this is specifically important for new healthcare professionals, and is also useful for healthcare professionals that are experienced, that have been in the job for quite a while. Sometimes because you've been in a job for quite a while, you might just end up being redundant, or what's the best word? You might think that you're so used to the job and then it becomes like a chore. In healthcare profession, it can't just be, like you keep replaying the same thing. Different clients, different people come with different conditions, and they are treated differently. And if you check my other videos, I've talked about effective listening. I've talked about, communication skills that are good. I've talked about etiquette of job. I've talked about different things. I've talked about different conditions. I've talked about dementia, which I am very passionate about. And I've talked about so many aspects. But today I just want to talk about your posture, how you are, how you approach your job. A lot of people that are in this line of work, because they are not prepared, the emotional intelligence is not quite there. See, let me tell you the truth. In this line of work, you must have high emotional intelligence skills, because you will meet different kinds of people. You meet people with mental health. You meet people with mental health concerns, people with hidden disability. You meet people with heightened anxiety. You meet people that are dying. You meet people that just want to leave. You meet people that just have given up. You meet people that are looking for love, for hope, for something. So that's why you must be ready. You must be prepared. You need high emotional intelligence. You must be able to understand when somebody says something, if they meant it, why do you think they said it, what is causing it, why are they agitated. Don't just think it's you. And then you have to separate your life from your work. So you can't say because you're at work, somebody's agitated and then you start crying. No, you have to toughen up. You have to be strong for yourself, for your client. Your client relies on you totally for everything that they do while you're there. They rely on you for their medication. They might not feel like taking their medication. You must have the right words, the positive words. You must be an encouraging person. You don't promise what you can't give, but you can encourage. Oh, I just want to die. Then the next thing you can't say you'll be fine, because you don't know if they will be fine. You don't know if their health will deteriorate or improve. So don't promise them that you'll be fine, because at that time they trust you. So the best thing is to say, all right, I know how you feel right now, but let's take it one step at a time. What is the first thing you need now? You need your medication. So take your medication. Just take your medication. Perhaps it may help you feel better. You see, I am choosing my words. It may help you feel better. It's always important to know the right thing to say and to say the right thing at the right time. Guys, always also report. If you see, I've done a video on reporting. You must report everything. So once you come into your client, you see how they are looking. You see, so that's what I'm saying. Emotional intelligence. You must read the room. When you read the room, you know the right thing to say. You know the right way to act. Sometimes you can put a gentle smile. Sometimes you don't have to smile. Sometimes you touch on the shoulder. Sometimes you hold on the hand. And sometimes you keep your hands to yourself. Emotional intelligence is knowing when to do those little things, because they make a whole lot of difference. Sometimes you should laugh. Sometimes you should smile. Sometimes you should be quiet. Sometimes you just need to sit with that person. Just be there. And sometimes you should be chatty. So it's always important to read the room, okay? Do more research on emotional intelligence. Understand the condition of your clients. If you know what they are living with, you'll be able to know you should know what to expect. So if you know that this client has multiple sclerosis, go and read about it. You know the client has chromosomal disorder, find out the specific chromosomal disorder and read about it. You're a healthcare professional. You can't be oblivious of what is happening. You must know. You must be smart enough. You know, yesterday I went to see someone and they were talking about medication and adverse effect of medication. And I do my homework. Of course, I've been a nurse, but I do my homework. I try to study I've been a nursing assistant. So I do my homework. I try to study about, medication, what a medication can do to someone and how a medication can affect someone negatively. And I pick on that and I use it for my clients. So I don't tell them, I say, well, the client says, what should I do now? I'm like, well, you still have to speak to your doctor. That's a wise decision. Speak to you. Don't tell them, oh, I think you should do this. Oh, I saw it. No, you read, just give them the information that like, okay, I heard that this medication. Oh, really? Oh, is that your experience? You see? Oh, so what should I do now? Speak to your doctor. I believe your doctor will have the best answer. And that's the best way to go about it. I hope this video has been able to help you. Please, you can always come back to me. You can ask me any questions. My name is Bridget Ezobiako, and I am a proud healthcare professional. I'm about to be a dementia specialist because I'm nearing completing my master's. Thank you all for always being there. This is Bridget, and have a good one. Bye.